much for the invite this morning, Claire, and to the rest of the team. As Claire said, my name's Catherine. I've been a dietitian for many, many years, based predominantly out of Cardiff and Vale, who I'm still hosted by. But as Claire said, I've had an all Wales role for the last 4 years, actually. So just kind of linking in with what you just asked, Claire. So I was originally within the All Wales Diabetes Implementation Group, so AUDIG as it was called, and then as Sue's explained now, transitioned into the NHS executive within the clinical strategic network. So I've got a dual role, and what have I been doing for the last couple of years? So this is often me looking at the window. This actually does look like my cat, and she is that big as well. But my role, I've had a dual role. So since January 2020, I took on the All Wales Dietetic Lead for diabetes. And then in April of 2022, for the other half of my week, I took on the lead as the dietetic lead for the All Wales Diabetes Prevention Programme. And my overall kind of aims have been to strategically develop, and I've got an operational lead role across Wales to support teams to make sure that all our interventions are consistent and they've got an evidence-based approach to diabetes-related food and nutrition education. And we're always aiming to try and kind of end aim of a once for Wales standardised approach to diabetes education. I'll talk a little bit more about those, adding on to what Sarah mentioned earlier. And then for the last couple of years, since April 2022, so coming up for 2 years, supporting the All Wales Diabetes Prevention Programme and the implementation across the 7 health boards. So what have we been doing in the sense of type 2 diabetes prevention, early detection and intervention? What have we been doing? So as Sarah alluded to with the slide she showed, that unfortunately that prevalence of type 2 diabetes has been on the increase. And that's the reason that the All Wales Diabetes Prevention Programme was been put into place. Wales was the only home country that hasn't had a prevention programme historically. England and Scotland have had one for a good number of years now. And as you've seen from that slide, our prevalence has been on the increase, and we've now got more than 8% of the population living with diabetes. And as Sarah alluded to, 90% of those live with type 2. And a lot of the conditions and comorbidities linked with that and the reasons could be preventable. And a huge amount of the NHS budget is spent on diabetes care. So a number of pilot projects were put in place through funding from AUDIG across the Avon Valley back in about 4 or 5 years ago. And the outcomes of these were taken to the health economics department in the diabetes research unit out in Swansea. And they really said that it was highly cost effective. So the projects looked at a short-term intervention to help support people to reduce their risk of developing type 2 diabetes. And they actually had figures for 615 patients that showed that 83% of those were able to reduce their blood glucose levels, with a much smaller number developing type 2 diabetes. And that was put forward and won a Quality and Care Award back in 2018. So how have we been establishing the programme? Well, as I said, it builds on these pilots, and it's a specific health behaviour change intervention offered at the targeted population. So Welsh Government secured funding, and this is a Public Health Wales-led programme, liaising and collaborating with the health boards. And it's been establishing to roll out that prevention intervention with robust evaluation across the primary cares in Wales. The funding had been £1 million up till 2024, and we recently had confirmed funding for another year as well. So we've had a process evaluation submitted, and there's outcome evaluation will come off the back as well over the next couple of years. So what have we been actually delivering? So who delivers it? We've got 7 local health boards. In all 7 health boards are involved with a local dietetic lead. We've trained up healthcare support workers within the Wales NHS workforce. And they've been trained and they're supervised on a daily basis by the dietitians. They're delivering that intervention out of community settings, so GP surgeries, leisure centres, other community venues, and offering face-to-face, telephone and or video if as required. And it's the intervention is standardized so that it's every patient can expect the same intervention, but remembering that it's still person-centered. Again, alluding to what Sarah mentioned, we've always got the person at the center of that conversation, but it's making sure that they've had their results shared with them and they understand what that means and what risks are relevant for them. We officially launched last June in 2022, and I'll give you some figures in a little while of where we've got to. But we're roughly at just over 50% of the clusters across Wales have got this intervention up and running. So just a bit of background, as we said, it's a what matters to you conversation, and then it's about looking at goals, what can the individual person set, and signposting and referring them on to additional services available in their area. So this was just to show you, we've developed what we've called our desktop resource, and for me, I'm a definite visual learner, and often pictures mean a lot more than words, and particularly if English isn't somebody's first language. So agenda setting, what matters to them, talking through the risk factors that could be applicable to the individual person, a little bit about what diabetes is and insulin resistance, what those blood glucose levels mean. So this amber is your pre-diabetes or somebody at risk of diabetes. And if you remember, somebody's diagnosed with type 2 diabetes when their HbA1c goes above 48. And then these figures we'll talk about again in a little while when we talk about remission. So this is the targeted audience, people who've already had a blood test done and been seeing that their blood glucose level is raised, but not high enough to be diagnosed with type 2 diabetes. And then some of the other infographics just to illustrate some of the food choices and differences that people can make to support reducing that risk and reducing the blood glucose levels. So just a bit of activity. We pulled together for World Diabetes Day last year, our annual figures. We'd identified just under 11,000 people at the time, and just over 7,000 of those were deemed clinically eligible for the intervention. For just over 4,500 people booked an appointment, and 3,800 people had attended. So we've had really good attendance rates. So the uptake of the actual intervention sits at about 64%. This is definitely in line with England and the predicted. We were looking at 50% of people would take up the offer, so we've had a higher uptake. And then of those that have booked, we're sitting at about 84% actually attend. So really good engagement from everybody. So moving on then to somebody who lives with existing type 2 diabetes, as Sarah alluded to in that value-based health, we really want to support people as early as possible with that intervention to delay the possible and potential complications further down the line. So is remission possible? Well, we know that it is now. There's been lots of research done over the last 10, 12 years. It was always deemed that type 2 was progressive and you'd definitely be on more tablets and if not insulin 7 or 8 years down the line. But the research has started to show that it's not necessarily a chronic progressive condition, that it's related to weight gain in adult life and that accumulation of excess fat within the liver and the pancreas. And the beta cells, which are the cells within their pancreas that produce insulin, were always deemed that they would steadily decline over time, and therefore somebody would eventually need medication and or even insulin at some point. But the research and the kind of research behind patients post-bariatric surgery had shown that a lot of patients were able to put their diabetes into remission, or the diabetes went away after the surgery. So this deemed the Roy Taylor and his teams to actually rethink this. And their kind of proposal was that the acute negative energy balance, so that very low energy intake following bariatric surgery, is what was able to normalize both those beta cell functions to be able to produce insulin again, and also the insulin sensitivity caused by the fat that was stored around them. And this is basically what the direct study had been looking at, is that if we are able to reduce the weight around the stomach area and particularly reduce the fat within the pancreas and the liver, those cells were able to start producing insulin again, and the body can manage the blood glucose levels much more effectively and hopefully with less medication or any at all. So the direct study was funded through Diabetes UK, and that's what it was doing. It was looking at, could an intensive weight management program help people to achieve type 2 diabetes remission? without the use of medication. The magic number appeared to be from the research is that about 10 to 15 kilos of weight loss is needed, so a significant amount. And they showed that just under half, 50% of the people were able to achieve remission. And this gave people that option to think about nutrition therapy rather than pharmacological and medical treatment. So it's given us another option rather than just looking at drugs. So going back to that what am I thinking about? Color coding, really, if you like, of blood glucose levels. As we've said, type 2 diabetes is when HbA1c gets over 48, and it was always deemed that it would always progress. But we now know that we can push it backwards. And I've seen personally people have been able to go back into pre-diabetes range and even into normal glycemic range and be able to come off significant amounts of medication. So what have we been doing in Wales? So literally, as I started my role, we had funding through ORDIG to pilot the real life implementation of mirroring the direct study of using the total diet replacement or the low calorie intervention to support people with type 2 diabetes to achieve remission through weight loss. So we started in January 2020. We were funded for approximately 90 patients, but when I show you the figures, we actually had 101. The inclusion criteria was for people who'd had diabetes less than 6 years, BMI between 27 and 45, and aged 18 to 75. So the intervention, the products we use are from a company called Counterweight. So they are shakes and soups. So there's a robust screening at the beginning to make sure that this is a safe and appropriate intervention for that individual. They have the option to use the shakes that reduce calorie for 3 months. They can extend it up to 20 weeks if we feel it's deemed appropriate and clinically appropriate, and the patient is coping well with them. The next phase then is 3 months of food reintroduction, so relearning eating behaviours, talking about portion sizes and really getting that quality and quantity right. And then there's 6 months of weight loss maintenance. So it's a 12-month intervention, and there is what we call a relapse management. So if somebody has a bit of a wobble or they gain a little bit too much weight, we can go back to use the shakes. So it's all very much person-centred and at their own pace. So some figures, as we said, we actually had 101 patients screened and were eligible, and 44 of those completed the 12 months. I want just to bring you up to the time frame. If you remember, like Sarah alluded to, we did start this in January 2020. So some patients did start before COVID. A couple of other areas, COVID kind of scuppered the start, so we were delayed with patients being able to start. But if you can imagine how this would be when we had the lockdown. So some people coped really, really well, and others obviously really struggled during that time, as everybody did. But generally, our mean weight loss through that 12-month period was 17 kilos. And the primary outcomes really mirrored the direct study, that 83% of those that lost over 15 kilos achieved remission. 50% of those who lost 10 to 15 kilos also achieved remission, but also there was a number of patients that achieved remission with a smaller weight loss. So overall, 87% of people involved improved their diabetes control from baseline. So you can imagine, for example, one individual had a HbA1c of over 100 when they first started, and at the end of 12 months, that had dropped to just above 50. So, okay, not remission, but obviously a massive improvement, and without more medication. That was the key thing that people wanted. And on that note, this is me doing a very rough guide. Rough kind of estimate, but you can see the patients, about a quarter were on no medication, roughly half were on at least one drug, and a good quarter were on 2 medication, and there was a percentage also that were on lots of medication. So we do know with people with type 2 diabetes, very often they can be on 3 or 4 types of medication, as well as maybe other things like hypertensive medication as well. So this was just the diabetes drugs. You can see that with a potential cost saving with these small numbers of nearly £24,000. So we've got really robust deprescribing guidelines and support for the GPs to support all the MDT team to help reduce the medication in a safe way. Just a few other comments of people, what prompted them to say this, I thought was interesting, that they it sounded like they were threatened with insulin. And obviously that was not something that they wanted to do. And you could see the majority of people wanted to come off their medication and hopefully get reverse their diabetes. So what are the other benefits? Well, we just talked about stopping inducing medication, but also think of that wider health benefits of weight management, as well as improved nutrition. So we're reducing the risks of heart disease and other diabetes-related complications, and improved mental health as well. Sleep better and joint pain. We often know that lots of people, when you're living with obesity, if you've got problems with your joints, carrying that extra weight can put extra pressure on that. So I'm hoping I've got a little, if this works. Oh no, it's the next slide, sorry. So just a couple of points. We know that it is possible now to get into type 2 diabetes remission, and that sustained weight loss is one of the key factors. And we know that that is a real struggle and can be a struggle for people, and that some weight gain is a normal part of a weight management journey. It's never a flat line. It will always come up and down, but it's about recognizing that and putting early interventions into place. And that actually, that conversation right at the beginning, when somebody's newly diagnosed, it can be a possible strong motivator and powerful motivator for individuals to manage their diabetes without medication and potentially put it into remission. But as something that Jonathan mentioned earlier, we do need to consider social environmental factors that have an influence on health behaviours, like we've alluded to, access to food, home environment, and what else is going on in somebody's life. So hence we have that really strong screening intervention, because we know this isn't going to be for everybody. And nutrition isn't a one size fits all. So this is a story. Claire, I'm hoping this is going to work. So I'll let Kath explain a little bit of her journey.
My name is Catherine. I struggled with weight since childhood. I attended Slimming World at age 11. I feel Slimming World fed into my unhealthy eating habits, also having a bad relationship with food. I was diagnosed with an underactive thyroid at 15 and a long history of mental ill health. I was prescribed antidepressants and mood stablers, which drove my appetite and hunger levels, resulting in further weight gain. Medication prescribed seemed to be never ending. I was given one medication which came with side effects, then another medication was added. My repeat prescription became 8 pages long. During this time I was also an inpatient in Whitchurch Hospital, and Nandock Hospital, and the Crisis House. This period of my life I had reached rock bottom, with little hope for the future.
Catherine was also diagnosed with type 2 diabetes in 2014, and at the time her HbA1c was 72, and she was started on a fair number of medications. She said she had a long prescription. She came to our department, and I met Catherine in 2021, and this was when we started the meal replacements.
My name is Catherine.
Oh, sorry, next slide.
Before I started meal replacements, I had a poor relationship with food. The food I was eating was poor quality. I felt sluggish, I was in pain, and I felt sick a lot. I was told by many medical professionals I would be on insulin and beta blockers for life. I just felt like there was no hope. From doing the meal replacements, I was able to gain control back. I regained a love for fresh food. I even started growing fresh produce in the garden. It gave me structure, and initially I didn't have to think too much about my meals. It gave me more energy, and I felt nutritionally complete. Like I explained previously, I am looking forward to 2024. I plan to get married, continue my weight loss journey, and to continue to get fit and healthy. I am so thankful for the support I have been given. For the first time in my life, I have a future and will continue my journey on getting fit and healthy. Thank you for listening to my story.
And then just to add to that, you see at the bottom then, January of last year, Catherine's HbA1c was 40. She had got it down to 38. And, you know, as I mentioned earlier, she gained a little bit of weight, but still had maintained her blood glucose levels into normal glycemia. So she got her weight down to 84 kilos, and she wasn't taking any diabetes medication. She'd also stopped using a CPAP machine, and she'd come off a lot of her antidepressants as well. So a huge, this lady, you know, put so much effort into this, and she said, so hope you found that helpful to hear it from her side. So what's next? We've currently got our second cohort ongoing, so through funding with ORDIG. That commenced in 2022 across 3 of the health boards. We're still catching patient stories and ongoing evaluation, and this to put a business case together to support this really as part of our menu of options for people. Excuse me, because as I mentioned, we know it's not a one size fits all, and this approach will really not be suitable for everyone. It is a small proportion. It's a very big ask to just have the soups and the shakes for 3 months. But the key is, as Catherine said, that it does provide people with the dietitians involved, that supportive environment, and making sure that it's implemented in a safe and effective way. So watch this space for that. And really this, talking about our menu of options, these posters are available. Claire, I was just thinking actually I can post these out to you as well, not post, email them out to you. So we put these posters together with partnership across Wales, just explaining all the different options to people. And we've got these either as a QR code or there's web links. And then the NHS groups that are available across Wales, we've got our like standalone module, for want of a better word, of a 2-hour session. There's Expert Diabetes, which is a 6-week program for those on diet alone and medication. Expert Insulin is for the people living with type 2 diabetes that take insulin. And then EPP do deliver some kind of more basic diabetes education sessions. So there's lots of programs available for people to join. There's also, Sarah alluded to earlier, My Desmond. So again, through COVID, when all the face-to-face interventions had to stop, we had funded a digital platform. So this has been available for the last couple of years, free for everybody living with type 2 diabetes in Wales. All you've got to do is search www.mydesmond.wales and send off a request to access. And then you've got access to that. That's been a really useful resource for lots of people. Anytime, any place, anywhere is my strapline for that one. And that's me. So thank you very much. I'd quite happily take any questions if I can stop sharing.